Although I've not had breast cancer myself, I know plenty of people who have. Many of them required a course of radiotherapy. Most of them found the prospect quite daunting, but actually found the treatment much more straightforward than they'd expected. To find out more, I'm visiting the Kent Oncology Centre at Maidstone Hospital, where many patients undergo radiotherapy. Naturally, like many women, I have lots of questions about radiotherapy. So who better to ask than the consultants and their team who specialise in the treatment? Can you tell me why patients need radiotherapy for breast cancer?
Most radiotherapy is delivered post-operatively. Post-operative radiotherapy reduces the risk of recurrence of the breast cancer, either within the breast or on the chest wall or in the lymph glands. Many patients who have breast-conserving surgery will require post-operative radiotherapy. Some ladies who have a mastectomy require radiotherapy, and occasionally we deliver radiotherapy to the lymph nodes under the arm or in the lower neck.
Most patients have surgery to start with, and the surgery removes the cancer. Either a lump is removed with normal breast tissue all around it, or if a patient needs a mastectomy, then the whole of the breast is removed. Radiotherapy is aimed at killing off any stray cells which might be left behind after surgery to make sure that if there were any cancerous or precancerous cells left behind in the breast, then the radiotherapy should get rid of them. If a patient has lymph glands under the arm with cancer cells, occasionally we treat the lymph glands above the collarbone, which is sort of the next step up in the chain, and in case there were cancer cells left behind in those lymph glands, then those would be treated by the radiation.
What exactly is radiotherapy?
Radiotherapy is X-ray treatment, so it involves targeting a beam of X-rays towards a particular part of the body, in this case the breast or the chest area, or very occasionally the lymph glands. So the idea is that the radiation kills cancer cells, and it can kill both actual cancer cells as well as precancerous cells. And it does cause some temporary damage to the normal cells in the body, which causes some short-term and long-term side effects.
So how do you and your colleagues ensure that you target this area precisely?
It's crucial with radiotherapy that you deliver the dose to the area you need to treat, and that we minimise the amount of radiation that goes to other parts of the body. That's why radiotherapy requires two crucial processes, the planning and the treatment. At the planning, we want to ensure that when patients start their treatment, we're accurately, reproducibly and consistently delivering the treatment to the part of the body we aim to treat, in this case the breast.
Okay, Amanda, we're now in the scanning room, so what happens now?
Firstly, I need to check your identity and to make sure that you're happy to go ahead with the procedure.
Right.
What I'll then do is lay you on our treatment couch in the standard breast position. So your feet are flat against the board.
Right.
Okay, and then I need your knees down. So push yourself up so your head is in the donut.
Yeah.
And then normally we would expose the breast area. But for today, we're just going to get your arms back and out of the way, into the supports, and the same on the other side. Okay. You can see there's green lines shining on you. They are lasers which we use to set the marks onto your skin and to help me with the scan. Okay, I'm just going to take you up and into the scanner.
Okay.
At this position, I would draw on a number of pen marks onto your skin, and I would put some little CT markers on, which then show up on our images. Okay, then I'm going to take you through into the scan. While the scan is on, you can breathe away normally, and it is going to be about a minute long. I just need to emphasise that your arms and these supports will need to be maintained for about 10 minutes.
Right.
Okay, so I'm just going to take you into the scan. We're ready to do the scan, so I'm just going to go out of the room behind the screen We have got an intercom system, so if you need to speak to me, you can talk away and I can talk back to you. And I'll be back with you in just a couple of moments.
Thanks, Amanda. I think the most reassuring part of being in the CT scanner was the knowledge that I was being overseen all the time by caring professionals.
The scan is complete. What I would normally do at this point is to put 3 little permanent marks into the patient's skin. They are tiny tattoos, but they are just the size of a pinprick. What we would do is introduce a little bit of ink into the skin with a needle. We just pierce the skin and then wipe it clean. We use these tattoos as an accurate way of reproducing the treatment every day. Instead of the pen marks which can be washed off, we use these little tattoos.
So, is that it?
That's it. We've taken all the information we need for the scan today, and we'll use that to produce a plan for your treatment. The final thing is what we would normally do is take a photograph of the patient, and we just use that for another double check for identity. And then that's it, free to go. I've received some images now of a patient, the breast images from the CT scanner, which I've got on the screen in front of me. So I can scroll through and find all the areas that I need to pinpoint to give the accurate treatment to.
And so, would you work together in this area?
Absolutely, we work very closely together. As an oncologist, my priority is to ensure that we're treating the whole of the breast to the appropriate dose, and that at the same time we're minimising the radiation to the other organs, namely the heart and the lung.
Once the scanning has been completed and the radiation beams accurately targeted, a series of final checks are made before the consultant signs off the treatment. Now it's off to the radiotherapy reception area to find out the sort of questions that we would all like to ask.
Good afternoon.
So this is where the patients come when they've got their first course of radiotherapy. What are the questions you're asked?
Everything from how they're going to arrive from transport, if they're having a simulation appointment or whether they're having treatment appointments, anything from a CT scan in which would they be able to eat and drink, would they need to have extra fluids, anything of that sort of nature.
Lovely. Thanks very much. Well, this is a fantastic piece of equipment. Can you tell me all about it, Josephine?
Yes, this is our treatment machine. It's called the linear accelerator, and we can rotate the machine to whichever angle that we wish to treat from. Okay, we've got hand controls that we use to move the gantry around. You lie still on the bed and the gantry moves around you. You don't have to lie. You don't have to move at all. And this is this couch on which you will lie. You're going to be in exactly the same position when you were planned, so that it would be familiar to the patient in the position that they're going to be lying.
Lovely. And Dan, what are you going to be doing?
I'll be stood just the other side here, and I'll be helping Josephine to get you lined up into exactly the right position.
Perfect. So it's real precision work.
Exactly, yeah. Okay, that's all the checks done and we're ready to go.
Okay, Jan, we're looking at you all the time. We're switching on now.
So, Christine, approximately how many sessions would I need to complete my course?
Most patients either have 15 to 20 treatments, and the doctor will decide that, and then we'll tell you when you start your treatment how many you're going to have.
And what are the patient's main concerns when they're having radiotherapy?
A lot of the patients are very anxious that they're in the room on their own and they may feel a bit claustrophobic, but this machine doesn't make you feel claustrophobic on the whole, and we are always watching them and we can hear them, and if they need us they'll call out and we can go in. The radiographer will see them every day, so they can talk to them about their side effects, they can see how they're reacting, and then they will give them advice as they go along, and if necessary they'll get a doctor to see them. So we manage them the whole way through the treatment.
Is there anything particular they should avoid?
What we normally say to patients is that they should wear loose clothing and not to wear anything too tight, not to use soap, not to use talcum powder.
those are the areas that we normally tell the patient but concerned about.
And how long would this go on for?
The reaction sometimes goes on for about 6 weeks after treatment, according to the patient's skin type and how they react. And the doctor will see them at that time and tell them when they can resume to normal washing habits and looking after their skin normally.
And once the patient's treatment has finished, what happens then?
What will happen then is we will give you an appointment to come back to see the doctor 4 to 6 weeks' time, when they will just assess how you've got on from your treatment. If in the meantime you have any problems, we will give you a telephone number where you can ring us, and if you have some skin problems, you can either come and see a nurse here, or we'll advise you to go to the GP, or we'll advise you to use some lotions, and we'll just keep an eye on you, and we can always bring you back earlier if you're concerned.
So that is all reassuring. But of course, with radiotherapy, I know there will be side effects. And so to find out what they are, it's back to see the consultants. Obviously, patients worry about side effects. What side effects are there?
All treatments have side effects, and radiotherapy is no exception. The side effects are short-term and long-term. The short-term side effects occur during the treatment or for a couple of weeks afterwards, and they're usually mild for radiotherapy to the breast. The commonest complaint is tiredness, which is not particularly disabling, and skin redness. There's a spectrum of severity of the skin redness. Some patients get very sore, other patients get no redness at all. Occasionally the skin blisters or peels or flakes in the fold of skin underneath the breast or in the lower neck, but it usually heals very quickly within a couple of weeks of finishing the treatment.
And what about long-term side effects?
The long-term side effects of radiotherapy are mostly cosmetic, to do with the appearance of the breast or the chest area, or what it feels like. So, for example, the skin can look a shade darker or slightly different to the rest of the skin. And although the soreness settles very quickly, the skin changes can go on for a long time or even be permanent in a very small proportion of patients. The breast itself can feel more firm or lumpy or look a bit sort of pulled up or smaller compared to the other breast. Occasionally it goes the other way, looks a bit more swollen compared to the other side.
And is there any danger to the surrounding organs?
We take great care to minimise the dose of radiation that goes to the surrounding organs, in this case the lung, and in the case of left breast cancers, the heart. And the modern technology we use to plan the treatment allows us to minimise the dose to these areas. Inevitably, though, a little crescent of lung lying beneath the breast will get scarred. We call this pulmonary fibrosis, though that causes few, if any, symptoms. The danger to the heart is now extremely small, one could argue negligible, because modern radiotherapy allows us to avoid the heart in most cases.
I wasn't sure what to expect, really. Maybe it's just the fear of the unknown. But after my visit to the Kent Oncology Centre, meeting the consultants, the radiographers and all those involved in the process, I've come away with a sense of relief and reassurance that breast radiotherapy is a safe and straightforward treatment, that great care is taken and modern technology is used to ensure the treatment is given accurately and safely, and that the radiotherapy causes relatively few side effects for most patients. Finding out more information about the cancer and its treatment can help give you back some feeling of control and feel more confident about your future. The Macmillan Cancer Information Centre in the Radiotherapy Department offers clear information and face-to-face support to discuss the emotional effects of cancer, its impact on relationships, and advice on how to talk about your cancer. There is an excellent series of booklets and leaflets to guide you through your journey. Information about specific cancer types, various treatments, symptom control, diet, complementary therapies, welfare benefits, information on local and national support groups, and many other subjects on how to live with cancer.